Dear friends, welcome to our channel. Today, I want to address some dangerous misconceptions about vitamins. It is quite common for people to believe that vitamins should be taken all the time and in large doses. However, this is actually incorrect. Allow me to share a couple of cautionary tales to illustrate this point. A friend of mine once read in a fashion magazine that vitamin A slows down the aging process. Excited by this prospect, she started taking high doses of vitamin A for an extended period. However, one day she woke up and found herself feeling weak, nauseous, and with a yellowish complexion. Naturally, she and her doctors assumed she had contracted infectious hepatitis and she was admitted to the infectious disease ward. Fortunately, the hospital quickly discovered that her symptoms were actually caused by an overdose of vitamins, not hepatitis. In another instance, a different friend of mine decided to take a vitamin as a preventative measure. She took relatively small doses of it for an extended period. However, she eventually experienced hair loss, itchy skin, rashes, and joint pain. Confused by her symptoms, she sought my advice since her joints were the most affected. It turned out that these issues were also caused by an overdose of vitamins. These stories highlight an important fact. Vitamins, when taken improperly, can lead to adverse effects. Even though many doctors prescribe vitamins as a precautionary measure, it is crucial to understand that they are not completely harmless and can potentially cause new problems. Among the vitamins, fat-soluble ones, such as vitamin A, D, and E, pose a higher risk of overdose. While overdosing on B vitamins is incredibly rare, it is not unheard of. Symptoms of a vitamin B overdose can include liver damage, jaundice, weakness, drowsiness, increased headache, elevated intracranial pressure, nausea, vomiting, joint and bone pain, and even hair loss. While extreme cases of acute vitamin A poisoning can lead to seizures, paralysis, and even death, these situations are exceptionally rare. However, chronic intoxication from excessive vitamin intake can occur, especially in those who take vitamins as a preventative measure. Therefore, it is crucial not to exceed the recommended dosages listed on the vitamin packages and to avoid prolonged courses of vitamin consumption. Now, let's discuss vitamin D. Our bodies have the ability to produce vitamin D independently when exposed to sunlight. However, for those of us living in less sunny climates, it is important to ensure we obtain enough vitamin D from external sources. In general, the dietary intake of vitamin D by modern humans is considered sufficient. However, doctors have become increasingly focused on preventing osteoporosis and often prescribe high doses of vitamin D for extended periods of time. Unfortunately, this frequent practice can lead to a condition known as hypervitaminosis, where excessive levels of vitamin D are present in the body. When someone has an excess of vitamin D, they may experience symptoms such as nervousness, high blood pressure, and persistent nausea. These symptoms are sometimes misattributed to issues with the gallbladder or pancreas, causing further confusion. Furthermore, an excess of vitamin D can negatively impact kidney function, resulting in the formation of calcium deposits and kidney stones. Interestingly, under the influence of excess vitamin D, stones can also develop in the gallbladder. While vitamin D may seem harmless, these are the consequences that can arise. To avoid such outcomes, it is advisable to take vitamin D in shorter courses. As a physician, I typically prescribe vitamin D to my patients for 1 to 2 months. It is also crucial to monitor vitamin D levels through regular blood tests, as well as calcium levels, since the two are closely related. Speaking of calcium, although it is not a vitamin, it is often prescribed by doctors for osteoporosis prevention. However, long-term calcium intake can also lead to the formation of kidney and gallstones, as well as increased fragility and loss of elasticity in blood vessels. Therefore, I want to emphasize that both calcium and vitamin D should be taken in relatively short courses, avoiding prolonged use for several years, as is sometimes recommended by certain doctors. Moving on to vitamin E, many consider it as an antioxidant that slows down the aging process. However, there is no concrete evidence to support this claim. Nevertheless, in reasonable doses, vitamin E can have its benefits. It acts as a fertility hormone, enhancing the ability to conceive and boosting male strength. Additionally, it offers protection against atherosclerosis. Nonetheless, some scientists believe that taking high doses of vitamin E for extended periods can raise cholesterol levels and potentially cause headaches and increased fatigue. It is worth noting that when high doses of vitamin E are combined with smoking, there is an increased risk of strokes. Now, let's dive into the topic of vitamin C, often hailed as the most useful vitamin by many. However, it's important to separate fact from fiction. There has been a prevalent belief in a giant scam surrounding vitamin C, with claims that it can cure all diseases. This theory originated from a businessman, but it quickly gained traction among journalists and pharmacologists, creating a lasting impact. However, extensive research conducted by eminent scientists revealed that megadoses of vitamin C do not possess the miraculous curative powers that were once attributed to them. In fact, the German Heart Foundation issued a warning about the ineffectiveness of high doses of vitamins, emphasizing that these doses do not prevent or cure diseases such as cancer or heart attacks. Moreover, during the annual conference of the American Heart Association in 2000, a group of scientists stated that large doses of vitamin C, taken by some individuals to treat atherosclerosis, may even accelerate the development of this condition. While excessive doses of vitamin C may seem tempting, it's crucial to exercise caution. It's advisable to consume vitamin C in reasonable and correct doses, instead of indulging in excessive amounts. Ideally, it is recommended to take vitamin C for a limited period, typically 1 to 3 months. Overdosing on vitamin C over an extended period can lead to the formation of oxalate stones in the kidneys and gallstones in the bladder. Additionally, consuming large doses can cause side effects such as nervousness, high blood pressure, itchy skin, and rashes. It's worth noting that the average modern diet already provides an adequate amount of vitamin C, thereby diminishing concerns about scurvy. However, it's important to mention that many individuals may experience a deficiency in B vitamins, particularly vegetarians, those on strict diets, individuals under significant stress, and the elderly. The good news is that overdosing on these water-soluble vitamins rarely occurs since the excess is efficiently excreted by the body. In conclusion, dear friends, it is crucial to subscribe to reliable sources of information, consume vitamins in reasonable amounts, and maintain a healthy lifestyle.